Thank you for joining us today in this immersive vasectomy experience. My name is Dr. Sijo Parekattil. I'm the actual patient today, so I'm getting my vasectomy done today, finally stepped up to the plate. And so I'm hoping you guys enjoy this. We're hoping that you'll get a real immersive experience of what it's like to go through an actual vasectomy. Our surgeon today is my partner, Dr. Alexander Galante, here at the Avant Concierge Urology. We're based in Winter Garden, Florida. And we're going to start with basically just talking about what is a vasectomy.
Vasectomy, long story short, is a form of permanent male sterilization. This is an extremely minimally invasive, effective, safe way for males to have contraception for life.
How do you perform a vasectomy?
Sure. So I use a standard guideline-based no scalpel technique. We make one small incision. We don't use a knife to make the incision. That's why it's called no scalpel, but nonetheless, the skin is separated. We identify both the vas deferens. There's two tubes that carry the sperm from the testicle to the urethra, and so we have to identify each of those tubes, one on each side. We've got to separate the tubes, cauterize the separated ends. Once that's been completed on both sides, the vas deferens tubes are released back into the scrotum, and the incision actually isn't typically closed, or at least that's not how we do it here. It's a very small incision, so we don't use stitches or glue. It's going to close on its own fairly quickly. You're going to do great. You ready to start?
Let's do it.
Let's go.
Welcome to the Avant Concierge Urology Surgical Suite. We recommend you ensure the video resolution is on the highest setting, 4K, in order to best see what's happening. The video is best viewed using the Oculus 3D technology or on a smartphone, so you can actually move your phone around and look around the room during the procedure. You can look at any of the screens to get the best view possible of what we're actually doing. We're going to show you my entire vasectomy in completion. I felt that since I performed this procedure on patients, it's only fair that I share my own vasectomy procedure with anyone considering this procedure. You can look at the time scale up top, and we'll show you the exact time and duration of the whole procedure. Initially, Dr. Galante is grasping the vas through the skin. We use a no-scalpel technique, so a sharp dissector is used for entry through the skin to expose the vas. You can see that he's got the left vas grasped through the skin with the ring clamp, and then he's using a sharp dissector to open the overlying skin. You can start to see the vas popping up right through that incision. We use further dissection with the sharp dissector to expose the vas, and now you can see the vas is starting to come right out. We keep teasing the vas out by grabbing it and re-grabbing it with the ring clamp and dissecting away the overlying tissue until all we have is just the vas, and that's been extruded out of the skin. At this point in the procedure, Dr. Galante is adding additional anesthetic to the area. He sprays it directly on the vas deferens and also injects a small amount directly into the perivasal sheath under direct vision. We've developed anesthetic techniques to ensure patients do not feel pain during the procedure if they're doing it while awake, and we also use the same techniques for the patients doing this procedure with IV sedation to ensure that they wake up feeling comfortable. We put a lot of targeted anesthetic into areas to reduce the risk of chronic post-vasectomy pain syndrome. Again here, Dr. Galante is dissecting out the vas completely from the surrounding tissue and from the associated blood vessel. Once we've got the vas isolated, we're going to go ahead and cauterize it. We're cutting through the vas and cauterizing each end. You can see the end of the vase coming from the testicle in the ring clamp. The side coming from the abdomen has retracted down into the tissue. The next step is the key step. We use a clip for fascial interposition, which essentially places a blanket of nearby tissue between the two cut ends, ensuring that they do not heal back together after the procedure. Now the testicular end held by the ring clamp is within a separate tissue compartment than the end buried underneath the clip. Once we confirm that we have a good fascial interposition and that there's no bleeding, the left vas deferens is released into the incision. Again, we like to add additional anesthetic prior to grasping the other vas deferens just to minimize the possibility that the patient feels anything during the procedure. Our top priority of patient comfort and safety. This also reduces the chance of post-vasectomy pain syndrome developing later on. We're going to bring out the right vas now, again using the ring clamps and the Vias dissector to isolate the vas from the surrounding tissues. We'll perform the identical procedure on the right side as was done on the left side. If you take a look around the room, you'll notice that there's a nurse anesthetist in the room to help keep the patient safe and comfortable while IV sedation is administered. We'll also have one surgical assistant or room assistant to help get supplies and make sure everything is going smoothly. We do have some TVs on the ceiling so that if the patients are having a procedure while awake, they can watch the procedure as well. Again, the vas is isolated from the surrounding tissues as it is brought through the incision. We do the entire procedure with just one small incision this way. The incision is so small that we don't typically close it with sutures or glue. The incision will close on its own within a couple of days after the procedure. Local anesthetic is applied again at this point, just prior to using the electrocautery to cut the vas on the right side. Once again, the abdominal end of the vas deferens has dropped beneath the underlying tissue. The hemostat is used to grasp and bring up the fascial layer that is being used as the barrier between the two cut vasal ends. This is again called fascial interposition, and this is a critical step in the procedure to ensure success long term. So now the vasectomy is fully completed and bacitracin ointment is being applied to the incision site, and this will heal on its own in a short time. And this completes the entire procedure.
It took me many years to come to this decision to do my own vasectomy, but I finally felt like, I had to step at the plate, and compared to my wife continuing with oral contraceptive pills or other contraceptive methods, this is a lot more safer with less side effects when you look at it from kind of a community perspective. So that's why I finally decided that this is the decision for me. And, for every guy out there, you're going to have to make this decision for yourself.